Thank you so much. Thank you everyone for being here. We will mute all lines here shortly, and when it is a speaker's turn to speak, I will unmute it. That way we can avoid any kind of unnecessary background noise or confusion as we move forward. This is being live streamed on the Health Department's YouTube channel for anyone that would like to watch it. And then also we have invited members of the media to be on the actual Teams meeting so that they do have the ability to ask questions live at the end of the press conference. When each speaker begins, they will be unmuted. Please cue me when you're finished so that I can mute you again. And then if you do have something to add at any point, you can either type something in the chat or use the raise the hand feature if there's something you'd like to add. When all speakers are finished with their short presentations, the media will have the opportunity to ask questions via the chat or raising hand feature. We will try to get to all the questions, but depending on time, we may have to cut that off. So we'll go ahead and get started, and I will give it over to Julie Moore-Wolf, and I will mute the rest of the lines. Give me just a second, Julie. And hold on, sorry. Yes. Julie, are you able to unmute yourself? No?
There we go. Can you hear me now?
I can hear you. You're a little bit quiet, and thank you, and bear with us, everybody. This is obviously a new endeavor here, so thank you. Go ahead, Julie.
Sure. I want to thank everyone who's tuned in today. You know, for 8 months, our community leaders have been coming together, our health department, Crossing, our FQHC, FQHQ, our Crossing Health Department, both of our hospitals, our first responders, long-term care facilities. We meet 3 times a week now, trying to deal with any problems that anyone has, any needs anyone has. And it's been going really well for the majority of this time. However, we're now hitting a surge that we expected last spring that didn't really hit us. But now we're being hit harder than we ever imagined would really happen here, especially this far in. And it's beginning to tax our resources. So we need to make a plea to everyone in this community to do your part, to really, honestly, we're all tired of this. We're tired of COVID. Anybody you would ask on the street or in a grocery store, everybody's tired of this. People are tired of wearing a mask, staying away from relatives and friends. But it's something we have to do. There is a light at the end of the tunnel. Vaccine is coming. It's not going to be here fast enough, but we know it's coming. We know we will get it. We are going to get there. So we just need you to hang with us for a few more months. Wear your masks, social distance, give up things that matter, like a big Thanksgiving gathering or a big holiday gathering, because that is only going to put more pressure on the healthcare system we have in our community. And we just can't afford to do that. And with that, I'm going to turn it back over to Brandy, who will call on our various speakers that we have today. Thank you all.
Thank you so much, Julie. Appreciate it. And I do just want to mention, so that we can make sure we're getting the right messaging out, the speakers are in their own offices by themselves. So while we are speaking, we will remove our masks and we are safely away from people. So we do want to make sure people understand you should always wear a mask at all appropriate times, and that we are being safe as we are removing them, and to ensure that you can get the message that we are trying to bring to you today. So from the health department perspective, of course, I will give you an update about the current situation. Our test positivity is 16.1%. The last time that we spoke in a press conference format, it was 11.7%, and we are very alarmed at that time. The target is 8, so we are over double that. As of right now, our case rate per 100,000 is 695. The threshold is 50, so we are significantly over that. We are announcing 158 new cases today, which would bring us to a total of 5,346. The last time we met with you just 3 weeks and 3 days ago in a press conference format, we had 2,824 cases. So we've seen a significant increase. And unfortunately, we have lost 37 Macon County residents with COVID-19 just in that 3 week and 3 day time period. So of course, our ask is for everyone to please continue to do your part. And if you haven't to this point, now is the time to do that. I do want to make the community aware that I have reached out to many of the superintendents for which I had contact information up to this point, and did strongly encourage them to make the choice to go all virtual or remote at least through January 15th, and to do that as soon as possible, but at least by the Thanksgiving holiday. We realize that people, despite recommendations to please not gather, that they probably will, and we are already in a difficult position with numbers and resources. So we're asking people not only to not gather, but for schools to go virtual. I did just send that communication out this morning. So if you have contacts with schools and school districts, please be patient with them, as I'm sure they're trying to figure out a lot right now. I am also asking faith-based organizations to make the choice to go virtual from now until the January 15th date. I am also pleading with the bars and restaurants who have not been compliant with the recommendations to please do that now. And I would also like to say thank you to the ones that have been. We realize all of this has been a very large burden on everyone in our community, but we are asking and begging you to please do everything that you can to help save lives. Also, please do not gather with those outside your household for the holidays. I realize holidays are incredibly important. They mean a lot to me too. But this is a year to make sacrifices and also to think outside the box and celebrate virtually or other ways that you can be creative to still make it special, but to make it safe so that we can all be here to celebrate in the future together. And then, of course, please make sure you get your flu shot if you have not done that yet. That being said, I would like to go ahead and hand it over to the hospitals to speak. And first, we will be having Michael Hicks with HSHS. And give me just a second. I'll make sure that you are unmuted, so you are good to go.
Thank you, Brandy. Appreciate it. I would like to say that we all need to kind of reiterate and strengthen the messages you just heard. We all need to participate, and the public can do quite a bit. A couple of things, the obvious ones are the staying at home as much as possible, social distancing when outside your home, wearing a mask, having excellent hand hygiene, avoiding the large gatherings, and then staying home if you are sick or experiencing any symptoms. And it's in that category that I think we can even go a little bit deeper. It comes with the idea of triaging yourself. So if you have mild symptoms that might be suggestive of COVID, please contact your primary care physician for advice on where to go next. If you need testing, there are opportunities, and you'll hear about several of them, I think, on this call, but there are opportunities. I know the HSHS Medical Group has a location in Mount Zion. We would encourage you to visit our website, as online registration is required, and that's available at hshsmgcovidtesting.org. I know there are other resources within the community as well. But if you are having more severe symptoms, then we would encourage you to come immediately to an emergency room and do not delay your care. So we are really trying to encourage all of us to participate here, that if we work together, if you'll recall at the beginning of all this, when we talked about this concept about not overwhelming the healthcare system way back months ago when this pandemic was first getting off the ground, we talked about that. We talked about the fact that we can't necessarily stop the spread of this virus, but we can mitigate it. We can slow it down, and we can prevent it from overwhelming our healthcare resources. And we learned what happened when we devoted all of our resources exclusively to this virus, and that there were a lot of negative health outcomes for people that had heart attacks and strokes, and people that delayed maybe their diagnosis of another disease such as cancer, or people that were injured and were reluctant to seek care, and maybe living with longer term ramifications of that delay in care. So if we can all be conscious of where we're at, trying to do a good job of assessing how serious our symptoms are, talking to our healthcare professionals, getting guidance, getting tested, and participating in these all these activities and this restraint, which is very tough, I know, especially with the holidays approaching. But if we can all engage in this as you're being encouraged here by the healthcare leaders in your community, we can have an impact and we can slow this down. We can't stop it, but as you heard Mayor Wolf talk about, there are much better resources on the horizon in terms of treatments are becoming effective. There are many articles that you'll read today in the press that talk about the fact that the mortality rate is dropping, and it's because we're learning as we're treating more and more. The body of knowledge of treating this disease, this virus, is growing greater, and we're having greater efficacy. So that's the really good news. The other good news is that there's not one, but there are 2 vaccines that are showing to be incredibly promising and much more effective than some of the vaccines that we rely on and are so effective for us during the flu season. So there is hope on the horizon, but we have to get there, and we have to get there for us in our community. We need to be conscious. If every community does their part, the nation will benefit. And if we all do a good job across the country and globally, then the world will benefit. So all of this begins for us locally right here. And if we are all responsible, we can slow down the progression of this disease. We can buy time so that our healthcare resources aren't overwhelmed, and we can buy line for those treatments and those vaccines to come online. So I urge you to just follow the common sense rules that have been put before you. Do what you can to restrict your gathering, which I know is at a very tough time as the holidays approach. But anything that you can do, it's not only to help you, it's going to help the members of your family. It's going to help the most at-risk members of our community, and it's going to help those frontline resources, those first responders who are challenged and never sure of what they're walking into right now. They're walking into an injury situation or a heart attack situation that may also be an infectious disease situation. So whatever we can do to help support them and keep them from being exposed to risk, that will benefit every member of this community. So please do your part. If you have questions, reach out. There are plenty of dedicated healthcare professionals in this community that can answer your question and guide you to the resources that you need. So I will pause there, Brandy, and turn it back over to you. Brandy, I can't hear you. I don't know if I've...
Sorry, I didn't unmute myself.
Okay.
All right, thank you so much, Mike. And I'll pass it over to Drew Early with Memorial Health Systems. Drew, if you want to unmute yourself and go ahead.
Thank you, Brandy, and thank you for those comments, Mike. I'd agree with what Mike said. You know, as we move through this pandemic, it's become very clear that injury and illness does not stop. So we need to make sure that we're preserving the capacity of the health system in the global sense to take care of all the patients that really need our care when the time is most critical. But we also have to acknowledge that right now at Decatur Memorial Hospital, there are 43 inpatients that have COVID. This represents nearly a third of our total inpatient capacity. 30% of our 193 inpatients right now are COVID positive. When you look across Memorial Health System, we have 162 patients that are COVID positive. These are real numbers. These are in our communities. And the strain and stress that this is putting on our organizations, and most importantly, our frontline healthcare workers, is very real. So I would encourage the public to remember those frontline healthcare workers. Remember that these people are our friends, our neighbors. These are the people we see at T-ball games and we see at church or at restaurants. These are people are doing really tireless work now, heroes work to take care of the community when it's needed most in incredibly stressful and difficult circumstances. So while the organizations are prepared and we're taking steps to be able to manage this volume, we also need to acknowledge that the volume is here. It's a very heavy lift for our frontline caregivers, for our doctors, for our nurses, for all the support personnel in the organization, and it's up to the public to help to manage this. Now, as we move through this pandemic, it's very clear. Wearing a mask works. I ask everyone to commit to doing that. Social distancing works. Thinking about where you're exposing yourself and your family. Washing your hands works, as does getting a flu shot. So if we can all commit to these very simple things, we can inflect these numbers down and really have a positive impact on our community and for the people that are taking care of these patients on a daily basis. So Brandy, I'll hand it back to you. Thank you.
Thank you very much, Drew. And we'll, if you want to go ahead and mute, and then we'll pass it over to Tanya Andrix with Crossing Healthcare.
Good afternoon, everyone. I want to make sure the community understands the testing resources that are available to you right now. Right now, between Illinois Department of Public Health and Crossing Healthcare, there's drive-through testing available every single day at the Civic Center parking lot. That will be available through the end of this week from Crossing Healthcare, and then IDPH will take over the Civic Center's testing site and will remain there through December 20th. At the same time, Crossing will open another testing location located on our campus on December 1st. This will increase the testing capacity for our community and give us basically 2 locations, and will, in essence, allow us to double the amount of testing that we're doing in the community. This is well timed. We believe that by the 1st of December, the testing requirements for the community will continue to increase. The next thing that I want to talk about is you have been charged as members of our community with a lot of things. You know, we as healthcare experts are asking you to, of course, social distance and wear your mask, but we're also asking you to consider smaller gatherings and consider changing up normal holiday plans, which we know is a big ask. There's one more thing that I'd like to charge the community members with, and that is taking care of your friends, your coworkers, and your neighbors. We have been battling this pandemic since March, and the toll that this is taking on individuals is great. I have significant concerns about mental health issues, and I think that with social distancing, with limiting the size of the gatherings and groups, can come fear of isolation. And so I want to make sure that the community understands that the state of Illinois and the federal government has very real and very reliable resources available to you all for mental health and mental health situations. And so you can text the word TALK to 552020, and you will get a response, and that is a state resource, and you will get a response with a therapist. There is also, at the federal level, you can text Talk with Us to 66746, and you will have someone communicate with you via text immediately to provide some emotional support or someone to talk to. And again, I know that we're asking so much from everyone, and I reiterate the message from all of those who have spoken before me. Our healthcare resources in this community are finite, and we must conserve them. You can do a lot, you can do your part, but also I hope that you will do your part to check on your neighbors and oversee the mental health of your friends and family, but also yourself, and take care of yourself through this difficult time. Randy, that's all I have.
Thank you so much, Tanya. And are there any other comments from any of the speakers? If so, just go ahead and type something in the chat or raise your hand. And if not, then we can move on to media questions. And members of the media, if you do have questions, if you could be specific to whom you would like those questions directed, then that would help. We'll go ahead and open it now. I'm not seeing anything from any of the speakers. While we're waiting for questions to come in, if there are any, I did want to clarify one point about the health department's ask for faith-based organizations and schools to go virtual or remote through January 15th. One of the things that we did communicate with was why January 15th. You've probably heard similar communication coming out in other counties, and they may have selected different dates, such as January 5th. The reason that we went with the 15th is because we know that there are many holidays people choose to gather to celebrate, one of those commonly being New Year's or New Year's Eve. And so we did go out the 14 days after that. So that is why that date was chosen. No, of course, COVID's not going to go away January 15th, but we do hope that if people do choose to gather, that will help cover some of the incubation period after those most commonly celebrated holidays. All right, so if any members of the media have any questions, I'm not seeing anything yet. We can wait a couple more minutes. Looks like the meeting chat might be muted.
I do have a question. I don't know if I'm muted.
I can hear you. If you want to
You
say
can,
who you
okay.
are, and then you can go ahead and ask your question.
Sure. Hi, this is Jennifer Jensen at WCIA. I know that you had said that school districts had just been notified of this today, but have any of the smaller school districts announced their plans yet, or are you aware if any of them plan to comply or not comply?
Not that I am aware, no. Like I said, it just did get sent out this morning. So I'm sure many of them are trying to review that and speak with their appropriate teams to determine what or if any changes they are going to make. So I haven't heard anything yet, and I don't expect them to report that necessarily back to me. But I'm sure if there are going to be changes made, we would hear from them in the near future. But of course, we need to be patient and give them time. What I did say in that communication is that we would like them to transition as soon as possible, but at least by the Thanksgiving holiday. So that does give them some time to make that adjustment. And we did not send that out to all, private schools. We sent it out through our superintendent, regional office of education. So there are some private schools that are just now hearing this ask. So definitely give them some time to process that and be able to move forward as well. I think, does anyone else have any questions before we wrap up? It looks like I had the chat muted somehow, so I apologize for that. That was my mistake. So if you do have a question, please go ahead and do the raise your hand so that we know you have a question. And I am not seeing anything else. So if that's it, then we can go ahead and wrap up. Thank you so much to everyone. The speakers, thank you for making time. I know that you have a lot going on. And thank you to the public and the media for joining us today. We appreciate it. Everyone take care and stay safe.